Zyloric tablets contain a medicine called allopurinol. It works by slowing down the speed of certain chemical reactions in your body to lower the level of uric acid in your blood and urine. Indications. Zyloric is used to reduce or prevent the formation of urate uric acid deposition in conditions where your body produces too much of a substance called uric acid. This may include gout or some types of kidney stones or certain other types of kidney problems, or when you are having treatment for cancer or other some conditions. In gout, the uric acid builds up in the joints and tendons as crystals. These crystals cause an inflammatory reaction. The inflammation causes the skin around certain joints to become swollen, tender, and sore when only slightly touched. You can also find you get severe pain when the joint is moved. How to use. Always take Zyloric exactly as your doctor has told you. You should check with your doctor or pharmacist if you are not sure. Take the tablet after food and swallow it with a glass of water. The recommended dose ranged from 100 to 800 mg each day. You will usually start on a low dose, which will be increased if necessary. If you are an older person or if you have reduced liver or kidney function, your doctor may prescribe a lower dose or to take it at longer intervals. If you have dialysis 2 or 3 times a week, your doctor may prescribe a dose of 300 or 400 mg, which is to be taken straight after your dialysis. Your doctor will usually start with a low dose of allopurinol, 100 mg per day, to reduce the risk of possible side effects. Your dose will be increased if necessary. Used in children under 15 years, the usual dose ranges from 100 to 400 mg each day. Contraindications. If you are allergic to allopurinol or any components of the Zyloric tablet. If you have liver or kidney function problems or heart failure. If you are pregnant or breastfeeding. Warnings and precautions. Talk to a doctor or pharmacist before taking your medicine. If you are of Han Chinese, African, or Indian origin, you have problems with your liver or kidneys, your doctor may give you a lower dose or ask you to take it less often than each day. They will also monitor you more closely. You have had problems or high blood pressure and you take diuretics and or a medicine called ACE inhibitors. You are currently having an attack of gout. You have thyroid problems. Side effects. Like all medicines, the medicine can cause side effects. Although not everybody gets them. The following side effects may happen with this medicine. Hypersensitivity. Uncommon, may affect less than 1 in 100 people. If you have a hypersensitivity allergic reaction, stop taking Zyloric and see a doctor right away. The signs may include flaking skin, balls or sore lips and mouth. Very rarely signs may include sudden dizziness, fluttering or tightness in the chest and collapse. Rare, may affect less than 1 in 1000 people. Fever and chills, headache, aching muscles, flu-like symptoms, and generally feeling unwell. Serious hypersensitivity reactions involving fever, skin rash, joint pain, and abnormalities in blood and liver function tests. This may be signs of a multi-organ sensitivity disorder. Bleeding in the lips, eyes, mouth, nose, or genitals. Any changes to skin, for example, ulcers of the mouth, throat, nose, genitals, conjunctivitis, red and swollen eyes. Widespread blisters or peeling. Very rare, may affect up to 1 in 10,000 people. Serious allergic reaction which causes swelling of the face or throat. Serious potentially life-threatening allergic reaction. Don't take any more tablets unless your doctor has to do so.